Welcome back, guys. Now in this video let's discuss about thrombosis. So what exactly is thrombosis? See, thrombosis is physiological or is pathological? It's pathological. Okay, so pathological what? See, whenever there is a damage to a blood vessel, say for example a blood vessel is damaged. When a blood vessel is damaged, then you are supposed to form a platelet plug and there you are supposed to have a clotting, and that's okay, that's normal, physiological. But unnecessarily if you are forming a blood clots, unnecessarily if you are forming a clot within the blood vessel, then it is called as thrombosis or thrombi. So it's a pathological formation. Okay, pathological formation of intravascular clot. So such clots are called as thrombi. Okay, so thrombosis is pathological. Okay, no doubt in that. Now, what are the reasons for the thrombosis? Why there is unnecessarily clot formation? Okay, unnecessary clot formation within the blood vessels. See, the causes of thrombosis are given by a triad. This triad is called as Virchow triad. So what exactly is there in this Virchow triad? I have discussed this in the general physiology also. Okay, general pathology also. Then cause number 1, okay, in the triad is endothelial damage. Endothelial damage. So when the endothelial cells are damaged, that can trigger the thrombosis, true. Second is alteration of what? Alteration of blood flow. Next, third one is hypercoagulable states. Okay, hypercoagulable states. See, these are the three conditions in which you can have abnormal formation of thrombi within the blood vessel, even without damage to the vessel. Okay, now first let's begin with the alteration in the blood flow. Okay, alteration in blood flow. So what exactly is this alteration in blood flow? Normal blood flow, let me write here, normal blood flow. How it is happening? The normal blood flow is like a group of soldiers who are marching. How regular they are? They are perfect regular. In the same way, the blood cells within the blood are also going in a proper streamlined fashion. The normal blood flow is a streamlined blood flow, which is called as a laminar blood flow. Okay, a normal blood flow is laminar blood flow. If there is alteration, means change from laminar blood flow to what? Change to stasis. Means the blood flow is not happening. Stasis, the blood is now sluggish, going very slowly. Okay, stasis, or even completely still like that. Stasis or turbulence. Turbulence, you know, turbulence means just whirlpooling of the blood. Okay, so whenever there is alteration in the blood flow, that is either stasis or even turbulence, they can precipitate or they can lead to formation of unnecessary clot within the blood vessel. Thrombi can form within the blood vessel. Okay, so why stasis, sir? In which conditions you can see these alterations in the blood flow? Maybe immobilization. So long time, for example, the patient is having some surgery and he is totally immobilized. For example, he is a paralytic. He had a stroke and he is totally paralytic. He is totally on the bed. Now there is a chance that he can have thrombosis, deep venous thrombosis within the legs below the knee. Okay, stasis can lead to formation of thrombi. Or turbulence. In which conditions you can see the turbulence? Turbulence can be seen with arrhythmias. Okay, turbulence can be seen with the arrhythmias. Now there is, for example, fibrillation, ventricular flutter. Okay, now ventricular tachycardias. Now whenever there is ventricular wall defects or tachycardias, there is a chance that now the blood is now just like churned. Okay, now the blood is getting churned. Now there is no proper laminar blood flow. Now there is a turbulence. The turbulence can cause thrombosis, activation of the platelets, turbulence activates the platelets, and platelets can cause the thrombosis. True. are conditions like aneurysms. Okay, aneurysms. Sir, aneurysms, what exactly are the aneurysms? For example, look here, this is the blood vessel. If there is permanent pathological dilation of a blood vessel, permanent pathological dilation of a blood vessel. Now here I am showing you that saccular aneurysm or berry-like aneurysm. Now blood is coming like this in a streamlined blood flow. Because of this, now there is whirlpooling. Now there is a chance that here the blood can whirlpool. Okay, now it can form whirlpools. So it's going like this. So here in this area there is a chance that you can form a blood clot. So aneurysms. For example, very classical condition, atrial fibrillation, that is arrhythmia, of course. Atrial fibrillation. Now atrial fibrillation, lot of times it forms the mural thrombi within the left atria, and there is a chance that the patient can have stroke because of this thrombi. It's getting embolized and there is block of the cerebral vasculature and the patient can have stroke. So at the end of the day, the point is, the alterations in the blood flow, that is either stasis or turbulence, can lead to the formation of unnecessary clots. Okay, so first thing is completed, sir. Alteration of blood flow is completed. Next is endothelial damage. Endothelial damage. So some students will get confused, what is this endothelial damage? Now we have discussed, see here, now we are discussing about the endothelial damage. Alteration of the blood flow is completed. Now I am discussing about the endothelial damage. See, why endothelium is getting damaged, sir? What are the causes? What do you think? See, the point which I want you to know in the beginning is, sir, endothelial damage is going to cause a thrombosis, true. But a proper healthy endothelium is preventing the thrombosis. That's also true. You should know it. So first let me write here, healthy, intact endothelium. Okay, sir, intact endothelium is going to prevent thrombosis. How, sir? Is going to prevent the unnecessary formation of the platelet microthrombi. How? See, the mechanism number one is, you already know it. I have explained you that these are the endothelial cells. Sir, endothelial cells, what they are doing? They are lining the blood vessel. As they are lining the blood vessel, what happened to the subendothelial collagen? Sir, the subendothelial collagen, whatever is there in the blood vessel wall, is it getting exposed? No, it's not getting exposed. Once it is exposed, yes, you know it, von Willebrand factor is causing the adhesion, aggregation, the other things. So endothelium is covering the subendothelial collagen. So first, endothelium prevents exposure of subendothelial collagen. Once the subendothelial collagen is exposed, it activates the clotting factor number. You know it, clotting factor number 12 is activated, 12 activates 11, 9, 8, 10. Clotting cascade will begin. Clot formation will occur. So healthy endothelium, it prevents the exposure of the subendothelial collagen, so prevents the thrombus. Okay. Next, sir, this healthy endothelium, it is going to release certain substances. Okay, this healthy endothelium, it's going to release certain substances which are going to inhibit the platelet formation. Which substances, sir? Number one substance is nitric oxide. Okay, don't forget nitric oxide is derived of arginine. Okay, amino acid. So this nitric oxide, what it will do? It is responsible for maintenance of the blood vessels in a dilated state. It helps in vasodilation. Okay, not only vasodilation, you also know the nitric oxide inhibits platelet aggregation by keeping the blood vessel open. It completely keeps the blood vessel open. Patency of the blood vessel is maintained. Nitric oxide. Okay, and the same endothelial cells, they will also produce something called as prostaglandin I2, which is also called as prostacyclin. Okay, prostacyclin. The point is, sir, this prostacyclin is a very important vasodilator. It's a vasodilator. Okay, and also to a certain degree, it also inhibits the platelet aggregation. So anti-thrombosis. Okay, healthy endothelium, see, it is always preventing the thrombosis, unnecessary clot formation. Now, these endothelial cells, they also produces molecules called as heparin-like molecules. Heparin-like molecules. So what these heparin-like molecules are going to do? So these heparin-like molecules, they will activate. Okay, the heparin-like molecules are going to activate. So heparin-like molecules, are going to activate antithrombin 3. So this antithrombin 3 is always there in our blood. It's always there in the blood. Okay, it's a plasma protein kind of thing. So this heparin like molecules, whatever are coming from the endothelial cells, what they are doing, they are activating the antithrombin 3. In the name itself, it's say antithrombin, antithrombosis. So this antithrombin, once it is activated, what it will do is it will inhibit the clotting factors. So no clot formation unnecessarily. Okay, antithrombin 3 inhibits the thrombin and other clotting factors. Okay, clotting factors are inhibited and thrombin also. Okay, next what else it will do? So this endothelial cells will also produce something called as a thrombomodulin. The fifth substance is thrombomodulin. Okay, thrombomodulin. So in the name itself it is a thrombomodulin. See, the thrombomodulin binds with thrombin. Okay, it binds with thrombin. Now, what is the normal function of thrombin? Just tell me. The normal function of thrombin is to convert soluble fibrinogen into insoluble fibrin and helps in the clot formation. Clot formation. Thrombin is procoagulant. It helps in the clot formation. You know it. But this thrombomodulin, name itself it's there. See, it changes. Modulating means changing the function. Thrombomodulin change the functions of the thrombin. Now thrombin, do you know what it will do? Now thrombin, it will activate something called as protein C. So instead of thrombosis, what it is doing? It activating protein C. Now you know what is protein C, sir? I have discussed protein C and protein S. They are anti-clotting. Okay, they are anti-clotting. So what is protein C is going to do? Protein C, it inhibits, very important, factor number 5 and factor number 8. So factor number 5 and factor number 8 are inhibited with the help of protein C. Done. Next, what else the endothelial cells are doing? Already you know it. Endothelial cells produce something called as tissue plasminogen activator. So this tissue plasminogen activator, you know it. It is going to convert plasminogen into plasmin. What this plasmin is going to do? Plasmin is going to inhibit the clotting factors. Okay, plasmin is going to inhibit the clotting factors. Anti-clotting, simple as that. So what I am trying to put into your mind is, sir, the healthy endothelium, here I have shown multiple mechanisms by which a healthy endothelium is inhibiting the clot formation. How it is acting like a anti-clotting. Okay, now let's discuss, sir, if the endothelium is damaged, now can such things happen? Can such anti-clotting properties are going to be retained? No. So now procoagulant. Okay, now the endothelium will favor the clot formation. So first let's discuss what are the causes of endothelial damage. Why endothelial damage? Let's write the causes. Causes of endothelial damage. Why endothelium is getting damaged? The number one cause, let me write, vitamin B9 and B12 deficiency. B9 is folate and B12 is cyanocobalamin. Okay, cyanocobalamin. So B9 B12 deficiency can lead to endothelial damage. Why, sir? I have said you the tetrahydrofolate enters into your body. Okay, once the tetrahydrofolate enters into your body, it's getting methylated. It accepts the methyl group. Now this methyl group is transferred to vitamin B12. Okay, now it's accepting the CH3 methyl group. Now this vitamin B12, it's actually a methyl donor. It donates the methyl groups to multiple reactions. This vitamin B12 is going to give this methyl group to homocysteine. Okay, the homocysteine, by accepting this methyl group, okay, by accepting that methyl group, it is going to convert into methionine. Okay, done. So what's happening? What's happening? The B12, okay, it's donating the CH3. B12 is donating the CH3. Okay, and homocysteine is accepting the methyl group. Now my question to you is, see, sir, if you are not having this vitamin B9, tetrahydrofolate, vitamin B9 or B12 deficiency, these things are not there, sir. If these two are not there, these two vitamins are not there, do you think homocysteine will be converted into methionine? No, it's not going to happen. So what happens to the homocysteine levels? The levels of homocysteine are going to rise. Okay, more and more homocysteine, that's causing homocystinemia. Homocystinemia, more and more homocysteine levels in the blood. I hope you already know homocysteine levels, the serum homocysteine levels, high levels can cause endothelial damage. Okay, once the endothelium is damaged, you know it, the anticoagulant properties are going to be lost and it becomes procoagulant. So the patients with homocystinemia is going to have endothelial damage, and these patients are more likely to develop thrombosis. True. So deep venous thrombosis are going to be seen in patients with homocystinemia, high levels of homocystinemia. Okay. Next, cause number 2 for the endothelial damage. Cause number 1 I have discussed. Cause number 2 is deficiency of cystathione beta synthase. Okay, so deficiency of cystathione beta synthase. Sir, what is this cystathione beta synthase is doing? It converts the cystathione beta synthase, let's write it in a simple form, CBS. Okay, cystathione beta synthase. It's going to convert homocysteine again. Okay, homocysteine into cystathionine. Okay, the homocysteine need to be converted into cystathionine. For that process, you need this CBS, cystathione beta synthase. If this is not there, okay, it's going to cause a condition called as homocystinuria. Again, even in this condition also, so the homocysteine levels are going to be elevated so much. Now these homocysteine levels are going to come out in the urine. So this condition is called as homocystinuria. Sir, in the homocystinuria, in this condition, which enzyme is deficient? Cystathione beta synthase. So high levels of homocysteine, these high levels of homocysteine will cause the endothelial damage. Apart from this, I want you to know, so these patients with the homocystinuria, they are going to have mental retardation. Okay, they are going to have what? Mental retardation. Endothelial damage is going to be there, mental retardation is going to be there, and these patients are, if you look at these patients are going to have lens dislocations. Lens dislocation. Okay, ectopia lentis. And its patients, if you look at their fingers are going to look like a long, spider fingers, which are called as arachnodactyly, or you can simply say these patients are going to have long, slender fingers. Okay, these patients are having what? Long, slender fingers. So this patient is almost having features similar to Marfan syndrome. So you can say a patient who is having homocystinuria, they are going to have Marfanoid habitus. Okay, Marfan-like look. These patients are going to have the appearance just like a Marfan syndrome. So second is also completed. Second reason for the endothelial damage is also completed. Other reasons for endothelial damage, the general reasons are going to be smoking. Okay, smoking, if I have to give the number 1 reason for the endothelial damage, I will give the smoking. So smoking, continuous smoking is going to cause endothelial damage. These patients are going to have thrombosis, unnecessary thrombosis within the blood vessels that can lead to ischemia and infarction. And alcoholism. Okay, alcohol is a toxin. The toxin can cause the damage to the endothelial cells. And hypertension, more pressure within the blood vessels can cause the damage to the endothelial cells. So hypertension, alcoholism, like smoking, all these are going to cause endo damage. Okay, endothelial damage. Now you know it. Once the endothelium is damaged, it becomes procoagulant. Okay, now it favors the formation of the clot. Now the last third thing in the Virchow triad. Okay, in the Virchow triad, the next thing that I am going to discuss is hypercoagulable state. Okay, let me write here. Hypercoagulable states. So hypercoagulable states. Why hypercoagulable states? Why the blood is becoming a thick, hypercoagulable? Is main reason is deficiencies of anti-clotting factors. deficiency of anti-clotting factors. I have said you always there is a balance in our body, always there is a balance between procoagulants and anticoagulants. You know the clotting factors. Clotting factors are what are the clotting factors? Like 1, 2, 3, 4, 5, like 7, 8, 9, 10, 11, 12 and 13. These are the clotting factors. And there are also anti-clotting factors. What are the anti-clotting factors? The two important anti-clotting factors are protein C and protein S. See, because of some reason, if there is a deficiency of protein C and S, protein C and S deficiency, okay, protein C and S deficiency. Now the anti-clotting factors are going down. Now it looks like the procoagulants are more. Okay, now there is an imbalance. Now as there is an imbalance, now the blood will be more procoagulant. Okay, the blood will be more procoagulant. So deficiency of protein C and S, which are anti-clotting. Next, what else, sir? There is something called as factor 5. Okay, Leiden mutation. So what exactly is this factor 5 Leiden mutation? So what is happening in the factor 5 Leiden mutation, sir? In factor 5 Leiden mutation, the factor 5 is not going to be destroyed. Okay, in the factor 5, normally the factor, you can cleave the factor number 5. Okay, the factor number 5 will be degraded, like after some time the factor number 5 is degraded. Now in this condition the factor number 5 is stabilized. You cannot degrade the factor number 5. Because of this mutation, the factor number 5 is beyond degradation. You cannot degrade it. It is going to be continuously active. So the point which I want you to know is, sir, there is a protein C and S. Normally they will degrade the factor number 5. I have explained you already. For example, look here. Here, see protein C, I have explained that it degrades the factor number 5 and 8. Now, in this Leiden mutation, the factor number 5 is not getting degraded because of the protein C and protein S. It is beyond degradation. It is resistant to degradation because of this mutation. So, the blood is becoming hypercoagulable. Okay, factor number 5 is continuously active. You know, once the factor number 5 is continuously active, it activates the 2, 2 activates the 1. Once it is activated, the soluble fibrinogen is getting converted into insoluble fibrin. You know it. Okay. Next, what else can lead to the deficiency of the what else can lead to the hypercoagulable states is nephrotic syndromes. Nephrotic syndromes. So what exactly is happening in the nephrotic syndromes? You know it. Now in nephrotic syndromes, there is more than 3.5 grams per day protein loss. There is more protein loss in a day via the urine. So via the urine, the more and more protein is getting lost. Okay, more and more protein is getting lost out of the body. So the point which I want you to know is, sir, which protein is getting lost here? Antithrombin 3. Antithrombin 3 is antithrombin. It's a anti-clotting. It's anti-clotting. So this antithrombin 3 is lost out of the body. So what happens? The antithrombin 3 normally inhibits the clotting factors. It inhibits the clotting factors. Now as the antithrombin 3 is not there, what happened to the clotting factors? The clotting factors are continuously active. That makes the blood hypercoagulable. Okay, that makes the blood hypercoagulable. Okay, done. So these are the different causes for the hypercoagulable state. At the end of the day, there is hypercoagulable state. Okay, you know it. That can lead to, that can favor the formation of the clot. And fourth thing, if a female is using oral contraceptive pills, oral contraceptive pills are nothing but the estrogen plus progesterone combos. So estrogen, if she is taking continuously estrogen, or by herself she is having hyperestrogenemia, if a person is having hyperestrogenemia. Now these estrogens, do you know what they will do? So estrogens act on the liver, helps in production of the clotting factors. So I can say estrogen increases the clotting factor levels in the blood. So estrogens are making the blood hypercoagulable. True, there is no doubt. If the person is having too much amount of estrogens, the patient can have deep venous thrombosis, DVTs. A patient who is having hyperestrogenemias, yes, there is a chance that she can develop that, like deep venous thrombosis possible. Okay, so done. So these are the different causes of formation of the thrombosis. Thrombosis is always pathological. My question to you is how to differentiate. Okay, how to differentiate thrombus with Postmortem clot. Okay, thrombus, how to differentiate with the postmortem clot is, for example, look, this is a blood vessel. Okay, here is a blood vessel. Now the patient is dead, sir. Now the patient is dead and you are doing the autopsy. Now you are doing the autopsy of the, like the heart. You have removed the heart and the coronary blood vessel. See, in the coronary blood vessel, now you are seeing a clot. Okay, now you are seeing a clot. Now you want to know whether this clot is formed after the death. See, after the death, the blood is not in the circulation. So if the blood is not in the circulation, definitely it's going to form the clots, no doubt. You want to know whether it's a post-mortem clot or is it a thrombus which lead to the death in this person. You want to know, okay, this clot is formed before the before the death or after the death. You want to know it. So if the moment I am looking at it, the moment I am looking at it, I can simply say this is a post-mortem clot. This is not a thrombus. This is a post-mortem clot. How can I say? See, it is not attached with the wall. So post-mortem clots, which usually form after the death, they are not attached to vessel wall. But the thrombus is usually attached with vessel wall. Okay. Next thing, what I can appreciate in a normal thrombus is, see, if you take this thrombus, okay, if you take this thrombus and just make it a section and just look at it under the microscope. If you are looking at it under the microscope, if it is a real thrombus, what you can say is, say, there is an area of platelets and RBC. See, for example, here is an area of platelets and RBC. Okay, RBC platelets are coming here. Now, on the RBCs and platelets, you are seeing an area of fibrin. Okay, there is an area of that fibrin is coming and stabilizing the clot. Now, again, you are seeing an area of RBC and platelets. And again, there is an area of this fibrin deposition. Fibrin is coming and stabilizing the clot. Okay, so thrombus, it's not going to occur just like that. So thrombosis is like a gradual thing, right? It forms as a small microthrombi. So more and more platelet accumulation, more and more fibrin, more and more platelet accumulation, more and more fibrin is coming. So you can see this layered appearance. Okay, you can see such layered appearance. So layer of RBC, platelets and layer of fibrin. So this is called as lines of Zahn. So these are called as, like these are lines of Zahn. Okay, they are called as the lines of Zahn. So lines of Zahn are seen in, they are seen in thrombosis, not in the postmortem clot. Okay, so with this I can differentiate whether it's a postmortem clot or thrombus. Two things, attached to the wall, not attached to the wall. Lines of Zahn present, lines of Zahn are not present in postmortem clots. Again, postmortem clot, lines of Zahn are not there. Now after this, let's discuss about embolism. Okay, now let's discuss about the embolism. So what exactly is embolism, sir? Now say here is a blood vessel wall. Okay, here is a blood vessel, or let's say here is a blood vessel. Now in this blood vessel, now this clot is moving. Sir, it is now freely circulating within the blood vessel. Okay, now there is a clot. Now there is a thrombi. Okay, now there is a thrombi which is freely circulating. It is not attached to the wall. It is freely circulating, and when it is going into the smaller capillaries, okay, when it's going into the smaller areas, it is going to definitely clot. It's going to definitely, it's going to completely occlude the blood vessel. Okay, it's going to completely occlude the blood vessel, which is going to lead to ischemia and infarction. Okay, ischemia and infarction. So this is called as embolization or embolism. So what exactly is embolism? Embolism is a floating, okay, it's a floating thrombus. For example, why embolism? Causes or types. Let me put it this way, types. The most common type, more than 95% of the times, okay, more than 94% of the time, the first type is usually seen, sir. What is that? Thromboembolism. Thromboembolism. So what is thromboembolism? You know it. Sir, actually there is a thrombus. Okay, here there is a thrombus. Now this thrombus with the time, okay, with the time it got detached. Okay, it got detached from the wall and now it is simply floating. So thrombus got embolized. Thrombus became an embolism. So thromboembolism, which is the most common type of embolism, thromboembolism. Okay. Sir, apart from thromboembolism, what else you can have is gas embolism. In which conditions you can have gas embolism? Sir, here who is the embolus? It's not a platelet clot, it's not a platelet microthrombi, it is gas. Now the gas is circulating within the blood vessel. So when you can have the gas embolism, for example, especially in sea divers. Okay, in sea divers, now yourself, okay, you are a deep sea diver, okay, you are diving into the sea. When you are diving into the sea, see, look, you are diving into the sea. Okay, you are going to, for example, 10 feet, 20 feet, 30 feet, 40 feet. Now you are going into the sea, sir. When you are again coming back, you know what happens? Actually, there is so much pressure, sir. When you are going down, the sea is going to, the ocean is going to show so much pressure on you. So when you are coming back, okay, the pressure is going to suddenly decrease. Okay, with rapid ascension. Rapid ascension means the pressure which is exerted on your body is gradually decreasing. You are ascending up. As you are going down, more pressure. As you are ascending up, the pressure which is exerted on your body is getting gradually decreased. So this rapid ascension which is seen in the sea divers, do you know what it will cause? It will cause precipitation of the nitrogen. Okay, nitrogen gas. Nitrogen gas which is present in the blood, it is going to precipitate. Okay, it's going to precipitate and forms gas embolism. That's one thing which is possible. This gas embolism can be seen during laparoscopic surgeries. Laparoscopic procedures. Okay, so during laparoscopic procedure, actually, for example, imagine there is some laparoscopic appendectomy. Okay, so what you are going to do, you are going to put a lot of gas first into the abdomen so that you are going to have a better, like, you know, the visual field and better like operability. Okay, you can operate better because you will get an extra space because you have totally inflated the abdomen, so you can better operate in that area. So for that, what gas you are going to use? You are going to use carbon dioxide gas. You are going to put a lot of carbon dioxide gas into the belly so that you can have a better operative, like, you know, area. So sometimes what can happen is this carbon dioxide gas, okay, a lot of gas is there, right? If there is any bleeding blood vessel, okay, through that bleeding blood vessel, this carbon dioxide gas, it can enter into the blood vessel and it can cause embolism. Okay, it can lead to the embolism. That's one thing. Or for example, like while doing the injections, okay, this is very rare. So like you are giving the injection, okay, while giving the injection without proper, like, you know, knowledge, if you give injection, what might happen is, see, there is air, okay, there is air in the syringe, okay, there is air in the syringe. Without knowing that there is air in the syringe, you have directly injected the medicine along with the air. So that can also lead to the air embolism, okay, or gas embolism. Okay, done. So there are three causes. Okay, there are three causes for the gas embolism. I have explained. Now, what else type of embolisms are there? So thromboembolism, which is most common. There can be gas embolism. The third type is, okay, the third type is amniotic fluid embolism. Okay, amniotic fluid embolism. I have already explained you in the topic of disseminated intravascular coagulation also. The amniotic fluid which is present, okay, within the uterus. Now this amniotic fluid is entering into the maternal circulation. What this amniotic fluid will do? It will cause disseminated intravascular coagulation, consumptive coagulopathy. This disseminated intravascular coagulation is going to cause microangiopathic hemolytic anemia in the mother. We have discussed. Okay. Now the last type of embolism which I want you to know for your exams is fat embolism. Okay, fat embolism. Here, who is getting embolized? The fat. See, whenever there is a fracture, okay, whenever there is a fracture, for example, fracture of a long bone, for example, the long bones are fractured. Now, in the bones, who is there? So, there is yellow bone marrow, which is fat, which is nothing but the fat. Now, if this fat, if it is entering into the blood vessel, if it enters, by chance, if it get access to the, for example, if there is a fracture, definitely blood vessels are also damaged. Now, these fat molecules are entering within the blood vessel. And from there the fat is circulating within the blood, and this fat can lodge somewhere and will cause ischemia and infarction. Okay, so the last type of embolism which I want you to know is fat embolism, which is seen with the fracture of the long bones. So these are different types of embolism which I want you to know for your exams. So with this we have completed the topic of thrombosis as well as embolism. Hope the video is helpful. Thank you.